Hi, my name is Keith Raftery, student number 17439184. This is my presentation for the preparation and investigation of PLA scaffolds under compression testing and accelerated degradation. Autografts can be successful, however they are not ideal. They are not readily available and may put the patient at risk in terms of pain and potential for damage in an otherwise healthy part of the body. The use of synthetic scaffolds for damaged tissue has made big strides in recent years. PLA, or polylactic acid, is the favored material for scaffolds. It is readily available, cheap, and the degradation rate into lactic acid occurs over a similar time to the healing of damaged bone. For these reasons, we hypothesize that PLA log pile scaffolds are suitable for bone tissue engineering. The main objective is to determine if PLA scaffolds are appropriate in bone tissue engineering through the use of mechanical testing, degradation analysis, and determining the effects of porosity on these factors. The log pile scaffold is designed using Fusion 360. Fused Deposition Modeling, or FDM, is used to develop a 3D scaffold. This process is carried out using the Ultimaker 3D printer. The mechanical properties of the scaffold are tested using the Zwick tensile testing machine. A 7-day accelerated degradation test is carried out using sodium hydroxide with a pH of 12 to characterize the degradation properties of the log pile. Here are the results and analysis from our experiment on the log pile scaffold. The results from the compression study show a significant difference for the compressive modulus between the solid and log pile samples. From the degradation study, results revealed that the solid PLA scaffold degrades far more than the log pile scaffold. There is also a significant statistical difference established in mass degradation between solid and log pile PLA scaffolds. The difference between strut width and pore size before degradation and after degradation is shown in this slide. The strut width remained fairly constant over the course of the degradation process, whereas the pore size decreased significantly over the 7 days in sodium hydroxide. The compressive modulus measured in the mechanical testing of the log pile scaffold covers the range given in the literature of 90 to 200 megapascals for compressive bone, making this log pile scaffold suitable to match the compressive modulus of bone. Although the pore size was much larger than the recommended range, this increase in porosity subsequently improves the mechanical properties of the scaffold. The degradation of the log pile scaffold was less than the rate in the solid scaffold. Figures 3 and 4 in the previous slide illustrate the pore size decreases significantly while strut width remains the same. PLA also degrades into naturally occurring lactic acid, which contributes to its biocompatibility as a viable scaffold material. The formation of struts in the log pile scaffold prevents the cells from falling through the scaffold when seeding from the top, increasing cell attachment and migration. The recommended porosity of 90% is not met. However, this porosity leads to an improvement in the mechanical properties while maintaining a suitable environment for strong cell attachment and proliferation. Following this analysis, it is reasonable to assume that we can accept the null hypothesis and conclude that PLA log pile scaffolds can be incredibly useful as part of a bone tissue engineering strategy.